If you ever peed into a cup at the doctor's office, then you probably noticed some little crystals floating around in your urine. Many people have noticed these crystals and wondered if they're normal. Well, let me tell you about calcium oxalate crystals, what they are, and why it's important to identify them. In this video, you will understand this and learn some tips. So keep watching. By the way, don't forget to hit that like button and subscribe for more awesome content like this. Now, shall we start? Section 1. What are calcium oxalate crystals? Let's start with the basics. Calcium oxalate crystals are tiny, jagged crystals that can be found in urine. They are formed when calcium and oxalate combine and precipitate out of the urine. Calcium oxalate crystals are the most common type of kidney stone, accounting for about 80% of all cases. These crystals can vary in size, from microscopic to large enough to be visible to the naked eye. Sometimes they can clump together to form larger aggregates, which can be even more concerning. Section 2. Why are calcium oxalate crystals important? You might be wondering why it's important to identify calcium oxalate crystals in your urine. Well, for starters, they can be an indication of kidney stone formation. Kidney stones are painful and can lead to complications if left untreated. If a person has a kidney stone, they may experience symptoms like severe pain in the back, side, or groin, nausea and vomiting, and blood in the urine. In some cases, surgery may be required to remove the stone. Additionally, calcium oxalate crystals can also be a sign of underlying medical conditions such as hyperparathyroidism, primary hyperoxaluria, or vitamin D toxicity. Identifying calcium oxalate crystals can help with early diagnosis and treatment of these conditions. Section 3. How to identify calcium oxalate crystals. Now that we know what calcium oxalate crystals are and why they are important, let's talk about how to identify them. The easiest way to identify calcium oxalate crystals is by doing a urine test. Your doctor can order a urinalysis or urine culture to check for the presence of calcium oxalate crystals. You can also collect a urine sample at home and take it to a lab for testing. During the urine test, the lab will examine the urine under a microscope to look for any crystals that may be present. If calcium oxalate crystals are found, your doctor may recommend further testing to determine the underlying cause. Section 4. Practical tips for protecting yourself. Prevention is always better than cure. Here are 3 practical tips to protect yourself from calcium oxalate crystals and kidney stones. Number 1. Stay hydrated. Drink plenty of water throughout the day to help flush out your kidneys and reduce the concentration of calcium and oxalate in your urine. Dehydration is one of the most common causes of kidney stones, so it's important to stay hydrated. Number 2. Watch your diet. Avoid high oxalate foods such as spinach, rhubarb, and nuts. Also, limit your intake of animal protein, sodium, and sugar. Eating a balanced diet with plenty of fruits and vegetables can help reduce your risk of kidney stones. Number 3. Take your medications. If you have an underlying medical condition that puts you at risk for kidney stones, make sure to take your medications as prescribed and follow up regularly with your doctor. Some medications, like diuretics and calcium supplements, can increase your risk of kidney stones if not taken correctly. In conclusion, calcium oxalate crystals in urine can be a sign of kidney stone formation or underlying medical conditions. It's important to identify them early to prevent complications and ensure timely treatment. If you suspect you may have calcium oxalate crystals in your urine, don't hesitate to talk to your doctor and get tested. Remember, prevention is key. By following the practical tips outlined in this video, you can protect yourself from kidney stones and the complications they can cause. Stay hydrated, watch your diet, and take your medications as prescribed. Finally, it's important to stay up to date on the latest research and guidelines related to kidney stone prevention and treatment. Your doctor can provide you with the most current information and recommendations. Thank you for watching. Don't forget to share this with your close ones. And share your thoughts in the comments below. I hope you found this video informative and helpful, and you enjoyed the video. If you're still struggling or have some questions, no worries. Check out this video for everything you need. Don't give up. Keep learning and growing.